Our next speaker is Maria Jammal, who's the co-founder and the director of Humanity Crew, an international humanitarian aid agency focusing on psychosocial support, who has just became a nonprofit NGO in Israel in November. Maria is an intellectual property lawyer, and she holds an LLM from the School of Law at the University of Haifa, as well as an LLM from the George Washington University Law School. She served as a member of the board of directors at the Musawa Center, the Advocacy Center for Arab Citizens in Israel. And she's going to be speaking about public health, human rights, and the Syrian refugee crisis.
Hi. So I would like to start by talking a little bit about three challenges, one of which, and the most obvious, is the war in Syria. And the lack of political resolution to that. And I would like to raise, just to raise a question or a suggestion about that, and to try to think what is the international community in general and the EU in particular, what is their role in involving the refugee population in resolving this matter, since we already know that more than half, or about half of the Syrian population is displaced, and many of them are in Europe, so this is maybe a good place to start in thinking of resolution to involve these people in it. The second point I would like to talk about is the EU-Turkey agreement, and I would like to show a few examples from ground. Why is the agreement itself is the huge crisis. So just before the crisis, as previously mentioned, the borders of the European countries has closed, and this led to having over 50,000 refugees stuck in Greece. And when I say stuck, I mean that they have got to Greece, which is the first point that they refuge from Turkey. So they get to Greece, and then all the borders are closed, and their only option for seeking asylum in any European country is either relocation, family reunification, or asylum inside Greece. So this has been a great challenge because I don't know if you're aware of this process, but as for now, when the Syrian refugees want to apply for a relocation program, this very infamous, good, perfect program, but they have first to apply for a date for an interview, and they have to do that by a Skype call, which is done once a week, 1 hour a day in this week, or twice a day if you're lucky enough to be in Athens, and they do that via Skype. That means that you need to have a phone or a computer, and you need to have internet connection, which they don't in the camps. So this itself has been a great challenge, and this has caused over 50,000 refugees being stuck in different kinds of camps across Greece, some of which were started to develop even before the agreement, in anticipation to the agreement, but as we see now, the conditions there are not even sufficient, at least to say. The last point I want to talk about is the intervention versus integration, since we are talking about the rethinking intervention crisis response. So one point that was mentioned is what is the EU role in integrating the refugees to enable or to improve the domestic challenges that they are facing, and therefore afterwards also being able to change in the international or regional level. And on that point, I would like to introduce you to our work, Humanity Crew work, and why is it very important to integration, and what is the type of intervention that we're doing. So Humanity Crew is an international agency. We're based in Haifa, and our focus is on providing psychosocial support to refugees in Greece currently. From what we saw, there is a huge gap in the humanitarian aid giving in this field in particular, and I'm going to show you and tell you what is the importance of this is. So our mission, as maybe it sounds cliche, but our mission is to reconnect the body to the soul. And I will explain it by telling you a short story from our experience in Greece. I was volunteering in Greece, in Lesbos in particular, Lesbos Island, with my husband in November, and after we were back, and he was telling his heroic stories about how he rescued many children, women, and men in the island of Lesbos, while he was working as a medic on the shores. He was telling his heroic successes, and then I was telling him we didn't have the chance to speak while I was volunteering at all, because we were volunteering in different places. I was volunteering actually in the camps and in the hospital. So when we were back, I told the story to my friends about a child called Alan that I met in a hospital. It was after a very big shipwreck that happened at that time. So I was telling him that there was this kid, that he was about three years old, and he was completely shut with no interaction whatsoever. And this, I found out that this is called like a stupor syndrome. So I was telling him the story that for a couple of days he was with no reaction. He didn't cry, he didn't laugh, and I was trying to explain to him what happened. And then when his mother arrived and they found his mother alive, a few days after, he was suddenly, smiling a little bit. We had a little bit reaction from him. But for me, as someone that is not from this background, it was very strange to me. So I was telling the story. And then when his mother arrived and she needed to do some tests, so I took the child and I told her, don't worry, I'm with him, he's safe. I will take care of him until you come back. And I took this child, he took me by hand, and he walked me through the corridor in the hospital to this glass door where you can see the lights of the city. And he puts his hand on the glass door and he says, I want home. And this were the first word he says in a few days. I didn't even know he was Arab, because we were trying to figure out a database of all the missing person and all the people that got survived in this shipwreck, and I didn't even know until a few days after when he spoke, and these were his last words. And then my husband looks at me and he says, okay, I'm a child psychiatric. And for a second there, I forgot that I'm a child psychiatric, and I forgot the role and the importance of it, because I did save the body of that kid, probably, but I didn't save his soul. So he would continue and he will grow and he will go probably to Germany or whatever country he will go to, and he will still be this post-traumatic child with so many difficulties ahead. So this is where we decided to come back as an organization and to provide these services that we saw that are very, very missing. And I would like to share with you the method that we do that in. So we work in, we have written this model of intervention. So the first step is the mobile clinic. And this, by the way, this entire model is also fit to other kinds and different kinds of refugee situations. But currently we apply it to Greece and to the Syrian refugees, Syrian and non-Syrian, but Arab speaking. So the first step is the mobile clinic, whether it is the beach, the rescue boats, the hospital, whatever the first interactions of the refugees with us is. So when the refugees arrived to the shores, we were on the shoreline waiting for them and to assist them. We provide psychological first aid, and that means that we would meet the refugees, we talk to them, we see what are the vulnerable cases. In many cases, we would see traumatized people in stress, and we try to reduce the stress. And this is based on research that show that the best way to reduce the effect of post-trauma is to deal with it in the scene of the crisis. So this is where we used to work. And the second phase of that first step is the second assessment, that we try to detect who are the most vulnerable cases, whether it is pregnant women, women traveling by themselves, or all other very fragile cases, and to refer them to special camps that host vulnerable cases. The second step is crisis intervention, and this is done either in camps, hospitals, or in other places where refugees stay for a longer time. And there we try to rehabilitate and to enable them to move on and continue. And we're talking about, especially here, about resilience, about making also community, and I will show you how we do that a little bit further. The first step is supportive psychology. So the most vulnerable cases that we meet in camps or hospitals, we try to connect with them online, either social media, a hotline by phone, WhatsApp groups, Skype groups, and we try to encourage them along the way, help them as we can, maybe contact them to other organizations along the way. So we try to also be there in their phase of movement. And the fourth step that we are also trying to implement now is the actual treatment. So to complete this cycle of the model, we would connect the most vulnerable cases to centers either in Germany or other countries that accept refugees, and to try to tell them, okay, this is the case, this is the vulnerable case. As you know, you look at every terrorist profile or every criminal profile you see in the background, migration, refuge, poverty, and you see all the signs that you should maybe open your eyes to. So we come and offer this platform. We say, okay, these are the people that you need to intervene with. These are the people that probably need treatment. These are the most vulnerable cases that you need to detect and help in integration. And this is what we are trying to do. We have so far contacted the Regensburg University in Germany, and we're trying to do some links with them, but we're mainly working on first step and the second step right now. After the agreement was implemented, you don't have any more movement. So our type of work has changed. They are now, as we said, stuck in the camps. One challenge is lack of information, lack of security. They don't know what's going to happen to them, how long they're going to stay, and we don't know how long we're going to stay. And as long as they're there, we're trying to help, but there's also only much that we can do in that matter to help in their asylum process. So we used to work in Lesbos until March, and then we're also working in Saloniki in a big camp that was provided for the refugees after the agreement. We work at the beaches and in the port where the refugees arrive. We work at the hospital and clinics. We provide translation, but not only that, also psychological support, whether it is to sick people that get admitted and they are alone. Especially we see many cases of pregnant women, and when I say women, I mean sometimes children of age 16, 17, their first birth, and they have to come by themselves to the hospital, give birth alone, and they don't know any of the implications or the process of birth. We had cases of we've met some really dirty and smelly babies, for example, and when we came and asked and talked to the mother, we found out that she was just scared. She didn't know how to bathe the child, or after she had been on the boat with her baby, holding it like this and scared of drowning, now she has to take the baby and put it in a boat-shaped sink and wash him by herself, and this is the difficulty. And this is the role that we play. We try to see these things. We try to understand what are the challenges, what are the difficulties of the population, because in many cases we also have, all of our volunteers are Arab speakers, and we have many cultural similarities. Language is only one, but we have also many cultural similarities that enable us to understand also this community and what are the needs, where do you intervene, where you don't intervene. And this is a very important factor. We also work in the camps and also on rescue boats. We don't only work on the shores, but we have now a staff that are working with Proactiva. It's a Spanish lifeguard organization that is working inside the sea. So we now have a team with them as they approach the refugee boats. They try to calm them and to ease the rescue. So this is the psychological rescue team that we have. In many cases, for example, if you see the picture on the right, in many cases we just try to avoid the trauma. You try to take any reaction that you can from either adult or baby. And here, for example, you see a baby with no reaction. And this is the critical stage developing a trauma, and we try to make them react in any way possible, whether it is by showing them a toy, playing with them, telling them you're a hero, everything is fine, and doing these kind of things. Another thing, we have different types of activities. Many of them are in Arabic. We try to do what others cannot do, other European organizations or other organizations, because it's very much needed. We have Humanity Crew Cinema for children in Arabic. Many different activities that try to involve also the community, the local community, and the refugee community itself in the activities of the camp, to make them do something, not only sit and think of how bad the food is and how bad the situation is and how bad the future is going to be, but to make them act and make them work. One of the things that we do also is, this is the picture of the hospital work, but one of the things we do also, we do educational programs for the children, where we teach Arabic, English, and sometimes we have partners from Greece teaching Greece. And the idea behind it is not only education, but also to make some framework for the children. And we found out that children love to learn, and they come, they wait until it's 10, and then they're sitting like this with their notebooks and pen and just waiting to be taught. So this is something really, really important that we need to focus on now. And the entire idea behind it is that the better intervention you have at this stage, the better interaction and integration they would have in the hosting countries. These are just more picture of workshops we do for international organization in Greece, because we are only a small organization, and we try to teach and show these cultural aspects to as many people as we can, so they can implement them as well. These are more pictures of our work in another camp. Thank you very much.